Hello, everyone. You are welcome to today's class, and now we are going to start off now. Yeah. Okay, that's fine. So let's start from Dr. Uloma. I'm going to, if you can see the screen, can you drop yes in the chat box? If you can see the screen, please drop yes in the chat box. Okay, that's fine. So, Dr. Uloma, are you ready for the class? Please unmute your mic. I'm not going to go into the basics because I've already made videos on what the speaking is all about and what you are expected to get during your speaking subtest in the exam. So in the exam, basically, you will have 20 minutes to go through 2 tasks. Okay, so I'm not going to dwell on that now I'm not going to dwell on that now to talk about all that. So by now you should learn what you are expected, what is expected from you. What I'm going basically to do today is to assess your speaking and see how you perform, and then drop 1 or 2 notes on that. Please, if you continue to disturb the class, I'm going to remove you from the group. Thank you. All right, Dr. Uloma, please unmute your mic. Hello, Uloma.
Hello, Dr. Tunde. Good evening.
Good evening. Can you see the screen clearly?
Yes.
Okay. Now, if you look at the screen, you have 2 tasks here. One is for the role player card, and the other one is for the candidate card. Right? For the candidate, that's how it will be on the exam day, but you'll be given only the candidate card. So if you are a doctor, you'll be given medicine candidate card. If you are a nurse, you'll be given nursing candidate card. So I'm going to give you 2 minutes to go through this, the candidate card. Please don't go through the role play card. I'm going to act as the patient or the interlocutor, while you will act as the doctor or the candidate now. Okay, so your 2 minutes starts now. After 2 minutes, I will ask you to start.
Okay. Good morning.
Good morning.
Okay, my name is Dr. Okafor Uloma. I'm the doctor that I'll be seeing here. Please, can you confirm your age?
I'm 45.
Okay, your name, please. Can you confirm your name?
I'm Joseph Anderson, but you can call me Joseph.
Okay, Joseph, what brought you to the hospital today?
Well, doctor, I'm really worried about the symptom that I'm experiencing now, because my father had the same symptoms, and these symptoms actually caused my father's death.
Okay, please, can you tell me the symptoms are?
Well, this morning while driving, I started to experience chest pains, and it's kind of excruciating, and it tends to move to the shoulder, especially the shoulder tips, and also at the back too. So it's really troubling.
Okay, so sorry about that. Please, can you tell me if these symptoms are associated with vomiting, or you're feeling as if you want to vomit?
No, not at all.
Okay, I really understand how you feel.
Yeah, but doctor, if I may ask, what I'm experiencing, what do you think it is? I'm just having that feeling that it may be a heart attack. What do you think about it?
Okay, Mr. Joseph,
Can you raise your voice a little bit, please? It's like you're using a microphone, so it's not very clear.
Okay. Okay, from the history of your father dying of heart attack, and you're presenting with this now, okay, I feel that what you're having is a myocardial infarction. Do you know what myocardial infarction is all about?
No, is it the same as heart attack?
Okay, yes, as a layman's term, you can call it heart attack, which is as a result of maybe insufficient blood supply to the heart. So people that have it will present with these symptoms that you're having now. Do you understand?
Oh, I'm really getting more worried, doctor. Is it something life-threatening? Because I'm really scared that it's actually took my father's life.
Okay, what will happen now is it's actually life-threatening. What will happen now is I will urgently transfer you to the hospital for advanced treatment. Do you understand?
Hospital? Well, I really don't like hospitals. Why can't I be treated here in the practice, please?
Okay, I really understand how you feel. I understand your concerns, but as I said before, the life-threatening condition that you need to be seen by a cardiologist. So a cardiologist needs to see you. That's why I transfer you urgently to the hospital for a specialist. Do you understand?
Well, it's going to be a difficult one. Okay, if you think that's the best, I think I will work with your recommendations then.
Okay, thank you for that. That is just the best thing for you now, okay?
Okay,
Do you have any other concern?
not at all.
Okay, thank you very much. I will do that immediately.
All right, thank you very much, Dr. Uloma. You tried, but before I make my comments, if you have anything to say regarding this presentation, can you raise your hand? I will give you the opportunity. Just only one comment before I make mine. It's okay, no one is willing to talk. Now, Dr. Loma, it's a fair try, to be honest, but I think the confidence is not there at all. I don't know if you are scared or something. And although initially your voice was kind of low, maybe you were using earpiece or something that didn't project your voice very well. The whole conversation, so to say, it didn't really flow naturally, to be honest. Now let's start from the beginning of the presentation, your introduction, because in your when they want to assess your speaking, there is what we call relationship building, okay, with the patient. And with these patients, your relationship building with this patient was not really very okay. That's number one thing, because at that beginning, you are just seeing someone for okay, let me not say you are just seeing someone for the first time, although this is a GP practice. I was expecting maybe you are the new doctor. You can take it either way. You can actually ask this patient his or her name, because I was expecting you to ask the name first before you ask the patient to confirm the age, because you might be a new doctor in the practice. You can also decide to be an old doctor in the practice, meaning you've been seeing this patient before, so you can actually call the patient by a name. Just give the patient a name. Usually in OET speaking, there will be a session. The first session will be for you to familiarize yourself with the interlocutor. At that point, the interlocutor will tell you his or her name. But I would really advise you, because in 70% of the time, you will definitely forget the name of the interlocutor. You will not even remember it. So if you can't remember the name of the interlocutor, what the interlocutor told you, you have different options. You can either decide to give this interlocutor another name and stick with the name, or you can decide to try to confirm the interlocutor's name. May I ask what your name is? Or you can just give the interlocutor a name. Hello, Mr. J. Okay, something like that. So I expected you asking the name first, because that's how to establish a rapport. You kind of introduce yourself first. I am this. May I know you, please? Are you Mr. Jackson? You will say yes. Okay, please, may I confirm your age? You will now say, I'm 45. Welcome to the GP practice. What brings you to the practice today? Okay, then the patient now come up with the complaint. Now, your empathy was very poor, yeah, because there are some empathic cues that you omitted. For example, this patient talked about at that initial point that it was this thing that caused his father's death. Yeah, I didn't see you like trying to empathize with this patient on that. I'm really so sorry that you have to lose your father because of this. Do you get? I understand this must have been quite traumatizing for you to have lost your father first at such age. Do you understand? You can even go ahead to after empathizing to, are there any other person that similar thing has happened to? You can say no or the. So when they say explore, try to explore. It mustn't necessarily be only the things in your cue card. You are a doctor, you know the type of things that you can ask. But remember, you just still have 5 minutes, so you don't have to go to market to gather all the ingredients for you to make the speaking work. So at that initial point, your empathy wasn't really very okay. Yeah, and now when when you were trying to explain that myocardial infarction to the patient, yeah, myocardial infarction is written on your task. The patient has already mentioned heart attack. You as a doctor already knows this myocardial infarction is the same as heart attack. So I think from what you've explained, I think it's actually in line with what you are. I'm afraid. Do you understand? That's how you break a news. You don't just go and blow it out. Okay, from what you've explained to me, you can even say, I want to examine you. You can go ahead and do that. And then from what you've explained to me and from the examination findings, I'm afraid that the symptoms that your fear is actually in line with the heart attack, and we call it myocardial infarction. Okay, something like that. Just make it very natural and make it look very real without trying to fake anything. You'll be consulting patients in your clinic and all. Okay. So I think these were your major challenge, but in terms of fluency, I think you try. So what I would really advise is for you to work on your empathy, because if your empathy is good, you know how to empathize. A lot of empathic cues that you can use, and try to make it natural. Don't just go and stick with the I'm so sorry, I'm so sorry. It's not always sorry, because you're not the cause of the patient's condition. Using something like, I'm afraid that what you told me, or I'm afraid that these symptoms may appear like heart attack, may be in line with heart attack, something like that. So if you say something like that, I'm afraid that you are trying to empathize with the patient by using that word, I'm afraid that. Okay, so I don't know if you have any question regarding this, Ulama.
Okay, thank you very much. I want to ask, is there any need of bringing this the background of hypertension and diabetes?
Yes, that's a very nice one that you didn't also mention, and it's also in your cue card. And these are the things that you can actually use to make your express yourself in a better way. Yeah, you can say something like, I'm bringing some things like this from what you've explained, from these symptoms that you've explained, and I can also see from your notes, okay, that you have hypertension and diabetes. How have you been managing that? Do you get? So with the symptoms you've explained and with the hypertension, and these are risk factors that may predispose you to having a heart attack. Do you get? But don't worry, I'm glad that you've come here today. We'll do everything possible to make sure that what happened to your father will not happen to you. Okay, so this is how you talk and make your interaction with the patient to look very real, and at the same time express yourself. Because if your empathy is very good, you are checking two things: you are building relationship with the patient and also incorporating yourself in patient's perspective.
Thank you, sir.
All right, that's fine. Okay, let's take a case note for is Abby still there? Abby? Starts now. Please start.
Okay. Good morning, Mrs. Samantha.
Good morning.
Yeah, it's Nurse Estinachi, your nurse.
Okay.
Oh, I can see you're not.
Okay, nice to meet you.
Okay. I can see you're not looking really too bright.
Yes, really not, I'm kind of feeling as if I'm not seeing very well and drowsy. I really want to know what is going on with me, nurse.
Oh, I'm sorry to hear that. Please, can you tell me exactly what happened to you?
Well, for the past 5 days, I've been experiencing this kind of dizziness, especially when I wake up in the morning and all. But this morning, while trying to get up from bed, I just felt drowsy. All I could realize is seeing myself on the floor. And as I got up from the floor, I started having these banding headaches, and it feels as if everything is becoming blurry.
Oh, Mrs. Samantha, I quite understand, because it shows the way you're looking. At least the other days I saw you, you looked brighter. But
Yeah, but
I
nurse,
don't.
if I may ask, do you think that this is a life-threatening condition?
Mrs. Samantha, you know, we cannot really say anything now. I cannot really say anything now to you, okay? But that's why I'm here. You're here. I'm going to help you out, okay?
Okay.
Let me just explain to you what we need to do, if you don't mind. Do I go ahead?
That's fine.
Okay. First of all, we are going to carry out an investigation, a test. We call it brain scan, okay? It's just sort of X-ray for us to look deeper into your head to see if there is any form of bleeding that is entering the brain, okay? So that if there is anything like this, then we could possibly hasten and refer you to the hospital for proper management, okay? Okay.
Well, I'm okay with the scan and all, but I'm really not happy going to the hospital or being admitted in the hospital, because I don't want to leave my cat behind.
Oh, I see. Thank you for expressing this concern, okay? Oh, you know, Mrs. Samantha, I really want you to relax, okay? I will try to make an arrangement with animal service to take care of your cat while you're on admission in the hospital. How does that sound?
Oh, that makes a lot of sense. That means they should be able to feed my cat, take care of my cat until I come back, isn't it?
Yes, beautiful.
Okay.
That's exactly what they will do, okay?
Oh, okay, that makes sense. Thank you a lot, nurse. But I want to find out one more thing. Do you think I may spend a lot of time in the hospital? Because I didn't want to know how long I'm going to spend in the hospital.
Oh, that's a beautiful question. Thank you for asking. Mrs. Samantha, you know, we have not carried out the investigation yet. We've not done that. We've not carried out the investigation. So I wouldn't really be in a position to tell you what will happen. When that is done, the doctors will decide, okay? I just want to plead with you to be patient. And once we follow this process, sure, the best thing will be done for you, okay?
Okay, that's fine. All right, nurse, thank you very much.
You're welcome. Please, do you have further concerns?
No, not at all. No, not at all. You've been
Okay.
very helpful.
Oh, thanks for your cooperation. Okay.
All right, your time is up. Well. That's really very beautiful, Esim Nachi. That's really very nice, your presentation. I think the flow, the communication, the rapport with the patient, you really did a very fantastic job with the presentation. But there is one thing I really want to still bring in so that you can also put it, but you still need more practice anyway. And I always encourage students to always get partners. If you don't have partners yet, just try and ask on the group and pair up with someone. The more you do these things, the easier it becomes. You might say, is it not speaking? It's not just to go and talk. It's not just to go and speak. A lot of persons are face speaking. I've been coaching students for the past 3 years. So don't take speaking for granted. But let me chip in some things. One, this person said that you should call her Samantha, but you added Mrs. Okay, don't do that.
Okay.
I've seen cases where students they now got stuck because they were not arguing between the student keeps saying sir. The interlocutor keeps saying, please stop calling me sir, I'm not sir, something like that. So try to avoid all that. And at the end, try to conclude very well. Okay, thank you. We've been able to do. Did you have any other concern? No. Thank you very much. And I will see you in a bit. Bye-bye. Something like that to end your conversation with the. Don't just leave it hanging because your task is already ended. But overall, I think you did a very fantastic job. And this will really give you a very good grade. Well done.
Thank you. Thank you.
All right. Let me see. All right, please start.
Good evening, sir.
Good evening.
Please, may I know your name, sir?
I'm Joseph.
All right. Okay, I am Dr. Matthew. I'll be attending to you briefly. Please, can you confirm your age, sir?
I'm 65. Please, I'm not sir, I'm Joseph.
Okay. Sorry, Joseph. So I understand you're a retired receptionist.
Yes, and I'm actually here because I've been I really want a hip replacement. I've been having a lot of troubles with my hip.
Okay. So this complaints, the hip, which of the hips are you having issues with?
The right hip.
Okay, so please, can you explain the nature of the pain to me?
Well, for the past 10 years, I've been having this, it's not like it's a new thing, to be honest with you. And I was diagnosed with osteoarthritis, and I've actually been managing this with naproxen and other painkillers. Unfortunately for me this morning, I woke up and I observed that I was unable to move my right hip. So I'm trying to lift it now. I'm even still feeling, I'm still in a lot of pains.
Oh, sorry. I understand how painful this must have been for you. Sorry, we'll do everything to see how best this can be taken care of. What you're having is osteoarthritis, just like you mentioned, and you know it's a chronic condition that goes on for a long time. And if it stops responding, if your symptoms stops responding to medications, you can actually have surgery that can take care of your pain. So the hip replacement you mentioned is one of the surgeries that can be done for the pain you're having, and it will be done for you. I will do everything to arrange for it, for it to be done. But the only issue is that because of the COVID-19 policy, it won't. It might not be really possible for now, but in 6 months time, or 6 months time or thereabout, you should be able to have the surgery. So we'll book you, we'll work you up for the surgery. We'll do some investigations for you, and also see that your symptoms are addressed while you're being prepared for the surgery. Since your symptoms seems as if they are no longer responding to the usual medications you're taking, there might be need to step up your medications to stronger analgesics, and you will also benefit from physiotherapy, and we also need to be seeing you more regularly, so that we'll be monitoring how you're faring with the drugs and the physiotherapy that you'll be doing. So I don't know if there are other concerns that you have. I would like to listen to them.
Well, I'm glad that you were able to ask me this question, because I'm really not happy with the whole explanation that you are making, to be honest. When will you say because of COVID policy that this surgery will not be feasible? Within 6 months. 6 months is actually enough time for me to get paralyzed if nothing is done. What are you guys doing in this hospital, by the way, doctor?
No, the COVID policy is just to ensure that prevention is maintained, because COVID-19 is actually very transferable, and we don't want to see ourselves aiding the spread of this virus. So, but I assure you that
because of, okay, I will stop you here.
So that in 6 months time you get.
It's okay. I will stop you here. Well done. It's a nice try. There is one thing I like about your presentation, the way you explain this situation for the patient. That's really very nice. But I'll correct some things, because I might end this meeting in the next 30 seconds. So what I want to explain here is, number one, in where you jump your points after point number 2, always try to bring your patients in. You've explained that this patient will be in surgery will be in 6 months time. Why not listen to see if the patient has something to say before discussing going to the next point? Because you've already jumped a point, and I was not able to make my own point that will lead you to your own point. So don't try to be jumping points from one point to enter another, from another you enter another. When you make one point, finish one task, bring the patient in to talk before you move on to the next. Then again, you were saying sa. So another thing that you also did that wasn't right is you were talking too much. I've already mentioned that, right? You were talking too much. So after each point, give the interlocutor time to also talk, and then move on to the next point. And again, the way you introduce yourself, and also I was expecting first for you to introduce yourself first before asking somebody his or her name. You don't ask somebody his name first before introducing yourself. I think it's like more like a course. Okay, try to first of all, hello, I'm Dr. Thompson. Please, may I know you? Are you this? Or you can just give the patient a name. That's also fine. Because of time, we'll be ending this speaking today. Within the week, I will also organize another speaking class, and I will try and make sure we spend more time to practice together. All right, if you like this channel, just hit the subscribe button so that whenever I have any class, you will always be the first to be notified. Bye-bye.